You have single select, a lot more choices available with this question type. You can add different choices. By default, it will show as a yes or no choice for the patient, but you can edit those. That's an editable field. You can also flag these responses. So if the patient answered yes to this question and I have this flagged, it would show flagged from the queue, which I will show in just one quick moment here, but it will show that the number of flags. So if you have more than one question that is set as a flag and that patient has answered a certain response to those questions, that flag will continue to calculate and add up to how many flags are available for the patient. And of course, you can always add more choices and delete choices as you see fit. Again, a theme here is that these question types are extremely customizable. So you have the ability to create these questions as you see fit. You can choose the display to the patient. So by default, it will display these choices horizontally, but if you want to show them vertically, you can just check this box and it will do that. You can add comment boxes. So if you want additional information from the patient, if they answer a certain way, you can type in the explanation to the patient so they know what information you want them to put in that box. And it's a free text field, so they can enter in as much information as need be. You can set this as required. And then branching. Again, if you came from Simple Admit, branching is the equivalent to the parent and child question relationship. You can create additional questions to appear should the patient answer the parent question or the first question a certain answer. So let's say, for example, a question is, do you have high blood pressure? If the patient were to answer yes, you could set up a branching question on yes to ask the patient a second question as a follow-up to that first question. Is it controlled by medication? And then the patient can answer yes or no to that question, just to give an example. So that's what branching is. And again, you have the ability to create these child questions or these branching questions yourself here. Next we have, I believe I did multiple selections. So again, same customizations. You can add multiple choices to this. You can display it vertically, add comment boxes. You also have a date question type. So this would show to the patient as a date field. So they would have to put in numbers in a specific format. So if you're looking for a specific date from a patient, maybe they had a procedure done and you need to know that date, or when they last took a medication, just to give a couple of examples. HST patient engagement also offers an equivalent or similar question type for medication. So here you of course have the option to title this question however you see fit, again, customize. And then the columns. We offer these first columns by default, and these are ones that we recommend you do not change because these are common questions that we see asked, and it's information that is very handy to have as far as medications go. And I know I probably don't need to tell all of you that, but you do have the ability to add additional columns here. One thing I will note about these default columns that we've provided, that if you do delete them, which you have the option to, you cannot add that back in the same format as it's set up for the patient. So again, that's why we say keep to the default columns here, and if you need to add additional columns, ask additional questions to the patient, you can do so by adding those columns. And again, you can set this as required as well.